Bismillahirrahmanirrahim. Very warm welcome to this webinar arranged by Saudi Society for Medical Education. And I'm Dr. Shazia Iqbal, Chairperson for Continued Professional Development Activities at Saudi Society for Medical Education. Our society always aimed to bring such an interesting and dynamic topic, especially which are really new, innovative in medical education and health professional education. So I welcome all participants. You know that in this rapidly evolving digital era, it is crucial for health professionals and educators to stay abreast of the latest advancement in technology and their applications in healthcare. And this webinar aims to explore the transformative potential of digital health in enhancing medical education and equipping further healthcare providers with necessarily skills to thrive the technology-driven landscape. The objective of this session and webinar is to provide an overview of current state of digital health and its impact in medical education. And this will highlight the benefit of incorporating digital health in medical education, including accessibility, personalized learning, and enhancing clinical decision-making skills. Not only this webinar will address the challenges and consideration associated with implementation of digital health in healthcare sector. I'm very much pleased to invite our eminent speaker, who is very much expert into digital health, Professor Georgi Chaltikyan. He's MD, he's PhD. He's professor and head of digital health at European Campus Rationale, which is a branch of Deggendorf Institute of Technology in Bavaria, Germany. He is founder and head of the Research and Education Center of Digital Health at Russian and Armenian University, and he is founder and chairman of Armenian Association of Digital Health. He has vast number of research in digital health, as well as he has a lot of collaboration with in national and international organizations. I will prefer if he would introduce himself in this webinar and his lot more work in digital health. So very warm welcome, Prof. Georgi, to this webinar arranged by Saudi Society for Medical Education, and very warm to all participants. With any further ado, I will hand over to Prof. Georgi. For the participants, questions will be taken at the end of this session, and recording of this session will be available for you by end of this session. So over to you, Prof. Georgi.
Thank you very much. Thank you very much, Dr. Iqbal, first and foremost, for inviting me to this webinar. It's a pleasure and an honor. My name is Georgi Chaltikyan, and as you already mentioned, I'm active in Germany at the institution where I work as the professor and head of digital health masters. That is Deggendorf Institute of Technology, University of Applied Sciences, based in Bavaria, Germany, and I also basically involved in quite a number of activities in my home country, in Armenia, through the Armenian Association of Digital Health, and a university in Armenia as well, where we established a research and education center of digital health and also operate a digital health masters. So there's a QR code landing on my LinkedIn profile. Feel free to follow me, to connect with me. It would be a great pleasure. And of course, thank you very much to all the attendees for following this session. So after a quick introduction into who am I and some information about our institution, I am prepared to take you, ladies and gentlemen, through some general information on digital health, including some concepts and definitions, the rationale, benefits and opportunities, as well as some challenges, barriers and limitations of digital health. Thereupon, I will be focusing on, in brief, of course, on some subdomains of digital health technology, And then we will discuss the global and national initiatives. So we'll be focusing a little bit on Germany. I will try to present you the challenging and quite, I would say, difficult, perhaps, journey of Germany in digital health. And in the second part of this presentation, I will be discussing and presenting some case studies of using digital health specifically in medical education. And as Dr. Iqbal mentioned, in the end of this 1 hour, we will reserve some few minutes for questions and answers. So I have been professor and head of digital health masters at this university in Germany since 2015. And in 2022, we were able to establish the same study program, Master of Digital Health, as a double degree program, also at a university in Armenia. So I'm mostly involved in teaching, research and development, as well as international project coordination. And I'm also honored to be a consultant to World Health Organization regional office for Europe. This is where our institute is, our university is located. It's a University of Applied Sciences founded in 1994. This year celebrating the 30th anniversary of the establishment. So it's relatively new, modern university, one of the larger universities of applied science in Bavaria with 8,600 students. Very well internationalized. We have a very significant proportion of international students. And the university has 16 locations in Bavaria, including the one where I am primarily based. That is named European Campus Rotterdam, and it is specifically an international campus that offers bachelor and master programs, as well as we have also some PhD students. All our study programs are taught exclusively in English, and of course, as many of you might know, there is no tuition fee for both local and international students at institutions in Bavaria. We're proud to collaborate with a good number of organizations, notably with major think tanks and non-profits active in digital health, such as HIMSS, Healthcare Information Management System Society, ISFTH, the International Society for Telemedicine and Health, the European Federation for Medical Informatics, the International Medical Informatics Association, with notable national and local players, such as the Bavarian Telemedicine Alliance or the Armenian Association of Digital Health, as well as with quite a good number of academia partners, universities in Spain, in Norway, in Sweden, in Czech Republic, in Hungary, and elsewhere. In a nutshell, the program that I'm leading, we like to call it I5 MDH, insightful, inspiring, but primarily innovative, interdisciplinary, and international. It's an MSc program that with a cumulative a total of between 90 and 120 ECTS, European credit points, with a strong interdisciplinarity and very strong international character, with project-based training. And we also strive to provide our students with exposure to global digital health community through participation in many events, such as last week, for example. I'm just back from Rome, where we attended and participated in one of the major digital health events, the HIMSS European Conference. And I'm happy also to mention that many of our students, they act as volunteers at HIMSS conferences and different other conferences. And notably, we also feature our own conference series or event series under the brand DigiHealth Day. That is an annual series of education, research, and networking events, culminating always in November, in mid-November, with rather big international symposium with quite a good number of top experts and opinion leaders in digital health from all over the world who are joining us, mostly on site in physical presence, but also virtually, and provide very important insights, a lot of teaching, education, and of course, excellent networking opportunities to our audiences. This QR code may lead you to the registration page of the event series. This is absolutely free to attend. Most of the activities are streamed, not only taking place on site on campus, but also streamed to online participants. So feel free to check it out and attend if you would like to. There's a very short video that I'd like you to kind of catch a glimpse of, and then we will proceed further. All right, ladies and gentlemen, I very much like showing, short cuts from talks by very prominent digital transformation, artificial intelligence, and information technology leaders worldwide, such as this is Ilya Sutskever. Many of you might recognize him, who is actually one of the masterminds behind the incredible success of OpenAI and ChatGPT. No longer with the team, unfortunately. Some of you may remember the dramatic events in the leadership of OpenAI in last November, in November 2023. But let's have a listen to what Ilya has to say about digital technologies in general, and a single example of how digital technologies are transforming our lives. And this is what we are stressing here always, that many of these technology leaders, technology pioneers and visionaries worldwide, whenever they mention the transformative and revolutionizing power of digital technology, if there is one single example that they bring, most commonly that example is related to healthcare and medicine. Take a listen.
The example I want to present is healthcare. Many of you may have had the experience of trying to go to a doctor. You need to wait for many months, sometimes, and then when you do get to see a doctor, you get a small, very limited amount of time with the doctor, and furthermore, the doctor, being only human, can have only limited knowledge of all the medical knowledge that exists. And then by the end of it, you get a very large bill. Well, if you have an intelligent computer, an AGI, that is built to be a doctor, it will have complete and exhaustive knowledge of all medical literature. It will have billions of hours of clinical experience, and it will be always available and extremely cheap. When this happens, we will look back at today's healthcare similarly to how we look at 16th century dentistry. When when they tie people with belts and then have this drill, that's how today's healthcare will look like.
Yes. So indeed, it is hard to overemphasize the importance of digital transformation for the healthcare. And I absolutely agree with Ilya and many other visionaries that the healthcare of that we are going to have in 5, 10 to 20 years from now, compared to how medicine and healthcare are practiced today, will indeed be as different as I frequently compare it to as what is today's latest Tesla model compared to 1930s Buick or Mercedes-Benz. To begin with an overview of what indeed digital technology in healthcare is and what it offers, I'd like to set the stage by a few points that, albeit are absolutely familiar to most of you, ladies and gentlemen, nonetheless probably are worth mentioning. The challenges and the problems that healthcare systems are facing everywhere in the world are related to, of course, aging populations, to epidemics, pandemics, and other global public health emergencies that appear, emerge, unfortunately, from time to time, to continuous growth in health spending that used to be about 10% of GDP globally, and it is continuously rising, and it is rising faster than our economies are growing, to the shortage of health workers. It is expected that by 2030, according to the WHO, the global shortage of health workers will reach approximately 10 million, which is more than 15% of the total amount of health workers in the world. Of course, there is the burnout of health professionals, and it has to be also mentioned that that burnout, unfortunately, is also partially caused by inefficient and outdated digital health technology as well. And of course, there are also growing expectations of informed citizens, consumers, the expectation to have ever better, ever more comprehensive, ever more affordable, accessible healthcare. And the digital health has, of course, become a hotspot of policy, practice, research, and innovation as something that is going to answer many of these challenges and is going to really transform the very humankind, if you wish. Digital health is considered to be a potential of up to 6 trillion market by the end of this decade. And there is one of the forecasts that actually says that by year 2050, up to half of global GDP will somehow be related to health and wellness. A little bit about definitions and concepts. This is how we understand digital health as an umbrella term that encompasses the domains of e-health as well as telehealth and telemedicine, and that has tight relationship with the scientific disciplines of bioinformatics, health and medical informatics, or health telematics. Within the scope of digital health, we consider 8 distinct subdomains, and we're going to present each of them in a few words in our subsequent section. And those are digital health records and information systems, as well as health information exchange, interoperability of records. The next one is everything about telehealth, telemedicine, virtual care, as well as personal health records and personal portals. The third subdomain is everything about mobile health, including digital therapeutics. Next one is all about imaging, then virtual, augmented, and mixed reality, robotics and gamings. Next is sensor-based monitoring and sensor devices, health data analytics and artificial intelligence, and finally something that I prefer to refer to recently as Tempe Health. We'll come to that in a few minutes. There is a very comprehensive classification of digital health provided by the World Health Organization. By using this QR code, you can find this classification online. It is freely accessible, of course, and freely downloadable. I'm not going to spend a lot of time on reviewing in detail this classification, but this is something that we very much recommend everybody look into. The benefits and opportunities in digital health are probably easily understandable. and already not disputable. This is all about improved access and improved quality of healthcare, also about improved financial management. It is expected that digital technologies should be able to also help global community somehow contain or a little bit at least decrease the rate of growth of health expenditure. Of course, digital health is all about increased efficiency of healthcare management. Obviously, digital health is cannot be avoided in health education, in medical education and research, and of course, the general education of the general public. Health education or health literacy is hard to imagine without digital. And digital health is furthermore even able to reduce the corruption in the health system and to further improve management of the health services. However, that said, of course, digital health is without its own challenges and limitations. And the goal of us, the digital health experts, and of course, a significant proportion of our teaching is related to these challenges and how to overcome these challenges. There is a need for commitment and the leadership by health authorities and public authorities, excuse me. I have to apologize for my voice and a little bit difficulties of talking because I'm having a rather unpleasant flu.
No
So
worries.
apologies for that.
No worries.
There's a need for quite substantial investment in order to make digital health work, in order to support the digital transformation of healthcare. There is a tremendous need for education, for training, for upskilling and reskilling of health workers. This is another thing that I am personally very active in. There is a need to improve the technical and workflow in digital health. There is frequently still inadequate regulation. There is a lot of fragmentation in digital health markets. There are tremendous challenges related to standardization and interoperability. Of course, data privacy and security remain and will remain, perhaps forever, a super important area of focus in digital health. And last but not least, the reimbursement, paying for digital technology also has to be carefully addressed. When we look at the specific subdomains of digital health, I will, as promised, try to go quickly through each of them. Health information systems, digitalization of health information system is the #1 subdomain. This is what we, excuse me, traditionally have referred to as e-health. That's all about electronic health records and clinical decision support systems, computerized physician order entry, electronic prescribing, and other applications. Virtual and remote care have demonstrated during the COVID-19 pandemic the importance of implementing virtual care. As you can see, as an example in Germany as well, once again, the uptake of virtual visits has grown, and this is not 1 point, this is 1,370%, ladies and gentlemen, in Germany. Compare these figures. In 2019, pre-pandemic, there were just 168 practices, clinics, and physicians who practiced telemedicine in Germany. At the peak of the pandemic, that figure was more than 31,000. It has been demonstrated that virtual care is capable of managing between 50 to 70% of all healthcare encounters. And I know very well that there are institutions and clinics in the Gulf region, in the Kingdom of Saudi Arabia specifically, and notably that are already very experienced and practice a lot of virtual care. Mobile health is a very active and very important subdomain. of course, with more than 6.5 billion smartphones worldwide, excuse me, that are available to more than half of the world's population already. We have a very significant number of various health and wellness apps available, with continuous addition to that pool of apps, making super important the question of app curation, right? Of presenting and grading and classifying the apps and including the most efficient and effective apps out of these tremendous amount that really make difference, provide improved patient outcomes, and could be or should be adopted by both health professionals and the patients. Of course, it's impossible to speak about modern and future healthcare and future medicine without extended reality and metaverse. And we will be later on mentioning a few examples, specific examples of using extended reality applications in medical education and training. I know that our host, Dr. Iqbal, is an expert and super active in specifically this subdomain. And but of course, extended reality is important not only in education, not only training of health workers, but also in multiple other aspects, such as for pain relief, for rehabilitation, and many others. The robotics in healthcare, robotics in medicine, especially surgical robotics. This is another area of application that has been developing especially recently, even though the proof of concept of telerobotic surgery took place already 23 years ago in 2001. However, due to understandable reasons, the telerobotic surgery is not yet at least become routine, become mainstream, but it can provide very significant opportunities. Let us have a quick look at this video that was published in China, actually in Hong Kong, South China Morning Post.
其实5G呢，就是让我们可以做到在很多场合，比如说救灾的场合，还有一些像边防上，还有一些呢，就是说像我们将来的基层和大型医院的连接，我们完全可以做到，就是让外科医生做到一个标准化的术式，一个人可以去做几千公里，或者是那个几百公里，各种各样的这样点对点的一些连接。
Telerobotic surgery remains somewhat a niche application, however, we will in the years to come. Furthermore, sensor-based wearable, sensor-based technology is another very important domain with proliferation of various devices such as wristbands and watches, smart cloths, ingestible sensors, even injectable sensors, and of course the current development and the biggest promise lies in the application of nanosensors. Artificial intelligence cannot be overemphasized. We are right now witnessing the so-called combinatorial explosion in AI, and that especially was fueled by the recent developments with deep learning and eventually large language models and other generative AI technologies. The factors that have led to this combinatorial explosion were nicely presented by John Norton in one of the recent pieces in The Guardian, as the availability of massive cloud computing power, the unimaginable quantities of data that are provided by the internet for training large language models, the significant improvements in algorithms that are boosted by neural networks, and most specifically, of course, the transformer architecture pioneered by Google in 2017, and last but not least, the money provided by insanely quote-unquote profitable tech giants. Artificial intelligence technologies are multiple in healthcare domain, ranging from public health to, of course, image analysis. This is probably one of the earliest and the most extensive use of AI, but also the performance in clinical trials, retrieval of medical information, and multiple automation approaches. This is just a list of FDA-approved AI tech, and as you can see here, radiology remains the largest and the most successful domain of application of AI, closely followed by cardiology and oncology. And especially large language models are nowadays providing fantastic new opportunities for revolutionizing both medical practice as well as research, and once again, notably medical education. We will be mentioning that also in the last section on digital health in medical education. There are multiple approaches that LLMs and generative AI can provide, both for medical professionals as well as for patients, ranging from supporting the clinical documentation process, creating discharge summaries, generating notes, all the way to clinical decision support, suggesting the treatment options, designing treatment plans, and so on and so forth. And for the patients as well, the interpretation of physical notes, the description of diseases, analyzing lab results, and other directions where LLMs are becoming right now indispensable. All of that, ladies and gentlemen, leads to eventually the implementation of something that we like to call 21st century healthcare. And this is what I frequently refer to as 10P health, drawing on the original P4 medicine, as suggested, the term suggested by Dr. Leroy Hood, who is considered the founding father of personalized medicine. I went away and expanded these 4 Ps eventually to 10 Ps: predictive, preventive, personalized, precision, participatory, pertinent, proactive, pervasive, permanent, and platform-based. And this is going to be the true healthcare of the 21st century that we all are aspiring for and moving towards. This is going to be around the concept of digital health twin, with automated collection and real-time analysis of health and wellness data, interpretation of that data, and AI-supported decision-making, decision control directly in the platform, accessible by each and every individual in the world. This is our vision of this so-called 10P health and digital health twins, and the data that will be integrated onto these platforms is going to be data from sensor-based devices, genetic data, of course, through gene sequencing, self-reporting, the so-called PROMS, patient reporting outcome measures, EHR, and other provider data, but also financial transaction data in the healthcare, ambient data coming from the environmental sensors, and even social activities data from social media, behavioral data, emotional data, and everything and all others. Now, this is another view of this so-called digital twin concept in health. Ladies and gentlemen, let's have a look what is happening on the ground, so to say. Of course, the World Health Organization has been instrumental in promoting and supporting development of digital health with quite a good number of important publications in the past years, and all in all with an excellent stewardship provided to member states in their digital transformation. The European Union, as many of you know, has recently launched a major developmental project known as European Health Data Space that has just been voted positively in the European Parliament a few weeks ago, that is supposed to be finally adopted by the newly elected already European Parliament as of end this year, and with implementation starting soon. And what is, in a nutshell, European Health Data Space is about creation of the pan-European ecosystem of both of health data for both what we call primary use, meaning to support clinical care of every European citizen, including cross-border activities and cross-border transactions, so within the entire European Union, and no less importantly, to support the so-called secondary use of digital health data, namely in research, but also in
I'm sorry. Yes, you can continue now.
The United States journey in digitalization of healthcare is quite an interesting case study. I will start with this case study in a nutshell, in few words. The US has adopted a major legislative act, the so-called High-Tech Act, the acronym for Health Information Technology for Economic and Clinical Health, back in 2009. Since then, they have invested more than 36 billion of US dollars into the digitalization of health information systems in the US. That led to significant increase in adoption of electronic health records and other health information technologies. The FDA in the US also established a track for software as a medical device and digital therapeutics for basically approving and licensing digital applications for use by licensed health professionals. There is ever increasing reimbursement for telehealth and for remote patient monitoring, and the FDA also provided its own regulation on AI in healthcare. Much more happening there that we unfortunately may not cover here due to the of course, time limitations. So I will be focusing in the next few minutes a little bit more on Germany. What was the Germany's journey in digital health with all the problems and perils and recent advances. Luckily, hopefully, we are on a good track nowadays. Germany is the world third largest healthcare spender, with a total of already approaching 500 billion, so €500 billion spent every year. It's a multi-payer primarily social insurance-based system. It's a huge sector that employs nearly 8 million people, 75% of whom are women, with almost 1,800 hospitals, and more than 300,000 physicians, and double of that number of nurses. However, until recently, Germany had one of the lowest levels of digitalization in Europe. Very interesting would be to have a quick look if there is a question like that, as to what were the reasons of these obstacles and of this slow progress, because Germany began its digitalization efforts more than 20 years ago. However, even in 2018, as of 5-6 years ago, Germany's digital transformation index was second lowest among 17 countries surveyed in Europe. However, a lot of things have changed since 2019. In 2019 through 2021, Germany has approved 6 legislative acts focused on digital health, ladies and gentlemen. In 3 years, 6 major legislative acts. And this is just to illustrate the importance of commitment by the leadership, understanding by the leadership of the importance of digital health, and corresponding actions, including legislative amendments. Then in 2023, they adopted here in Germany the new digital health strategy. And in February 2024, Bundestag enacted 2 further legislative packages to prepare Germany's health system for adoption of European health data space. Much of these activities are coordinated centrally by an agency named Gematik, in German Gesellschaft für Telematikanwendungen der Gesundheitskarte. And this is basically the National Digital Health Agency in Germany. Just to illustrate how basically how challenging has been this journey, ladies and gentlemen, I wanted to focus or to call your attention to specifically 2 legislative acts here. One passed in December 2019 is the so-called DVG, Digital Care Act. And this was the legislation that for the first time ever in the world provided the framework for prescribing digital health apps by physicians and reimbursement of those apps by health insurance companies. Another important legislative act was passed in 2020, and that is the so-called Krankenhauszukunftsgesetz, or Hospital Future Act. And this is the legislation that, similarly to the US, provided federal and state-based investment in the range of 4.3 billion euros in order to improve the situation with digital health at Germany's hospital that used to be, frankly speaking, quite disappointing. As we can see here, in 2 years ago, in 2022, the major project named Digital Radar, Digital Radar Krankenhaus, Digital Radar of the hospitals, conducted a survey of a total of 1,600, so basically 80% of all German hospitals, and they found out that the on average digital transformation score at the hospitals was just about 33 out of 100 points. And to put that in context with the so-called MRAM system of grading digitalization of hospitals, the MRAM score in majority of the hospitals, ladies and gentlemen, was 0 or 1 out of 7. Of course, currently the situation is improving. Nonetheless, there is still, you can see here, the percentage of adoption of various digital services in Germany's health system, including, for example, just a quarter of patients scheduling appointments online. Information on clinics on social media, just 11%. Reminders about the appointments, just 17.6%. And so on and so forth, and ranging up to the 37%. This is the best score, and this is the virtual visits. Once again, quotation mark, thanks to the recent pandemic. Here we are currently also rolling out the nationwide electronic health record. This is another important development. However, here as well, up to now, there has been very insufficient adoption of this technology. Electronic prescriptions are currently growing at a very good very good rate, very good pace. Why? Because as of January this year, 2024, it became essentially mandatory for all physicians and practices in Germany to offer electronic prescriptions. And now we are already at 50% of all prescriptions being filed electronically, and we're assuming that by the end of this year it might reach the level of nearly full digitalization of prescriptions. Another hint here, how important, is something that I commonly refer to as top-down approach, with legislation and with even mandating some digital interventions. Same happened with this Digitale Versorgungsgesetz, the DVG, the act that I mentioned, that provided a possibility for physicians to prescribe applications, and this is what here in Germany we refer to as DIGA, for Digitale Gesundheitsanwendungen, literally digital health apps. And thanks to that, we currently have approximately 60 digital mobile apps that are included in the repository, that are available for download by the patients and are reimbursed by the insurers. Germany, of course, is the largest digital health industry in Europe, providing approximately 17% of European digital health companies. Germany's digital health market size is predicted to reach nearly 40 billion by 2033. Excuse me for this typo. AI startups are also growing in Germany. So all in all, there is quite a good development. And also, as I mentioned, there are two acts. One of them is, we call just like that, a Digital Act or Digitalgesetz. And another one, a Health Data Usage Act, that both are designed to prepare the country's health system for further digital transformation and for adoption of European health data space. Last section, ladies and gentlemen, I've structured it as follows: the 10 ways how digital health technology is supporting medical education. For each one of these 10, since due to the lack of time, I will be going through these 10 quite fast. But what I could recommend is we have here a QR code that will open up for you the corresponding web page with a case study under each of the applications. For example, extended reality. By this QR code, you can find out the Imperial College London Faculty of Medicine launching a brand new, just end of last year, course titled Extended Reality in Healthcare Education and Clinical Practice. So please check it out. Online learning platforms for medical knowledge dissemination. This is as an example, as an illustration or case study, the Han Academy in Pakistan, which provides free online courses, including multiple medical subjects. Number 3, telemedicine for clinical skill development. As an example here, we have University of California, Davis, that uses telehealth in its training program, allowing students to consult with patients remotely under supervision. Number 4, electronic health records for teaching clinical documentation. An example here, the so-called TEMR, or Teaching Electronic Medical Record, developed by one of the global digital health leaders, the Regan Street Institute in Indiana, United States. Number 5, AI-powered personalized learning. The learning of medicine, pretty much as elsewhere, will become as personalized, as revolutionized by artificial intelligence as health and healthcare per se. And one good example here is a company, Osmosis, a medical education platform by IBM, that uses AI to personalize learning experiences for medical students based on their specific strengths and weaknesses. Number 6, simulation-based learning and assessment. As an example, this is the Harvard Med School Center for Medical Simulation. This is also all about digital technologies. Number 7, mobile apps for on-the-go learning. Medscape is an excellent example here, and this is the QR code that will allow you to download and use for free actually, Medscape app for medical education. Number 8, interactive digital textbooks and e-learning resources. Inkling could be a good example here. Number 9, wearable sensor technology in education. This QR code will lead you to an excellent systematic review of how different biosensors can be integrated in teaching process and how these could impact education. Finally, last but not least, definitely, is the gamification, serious gaming for enhanced learning engagement. And this QR code can demonstrate you the company named Medical Joywork that produces several actually mobile apps that use gamification to teach medical students through interactive case studies and medical quizzes. Lastly, there's a few additional QR codes to books that I personally very much value, and I definitely recommend every health professional interested in digital health. Those are Deep Medicine by one of the luminaries, Dr. Eric Topol, the AI Revolution in Medicine that was published very recently, specifically about GPT-4 and beyond, and of course, the Age of Scientific Wellness, which is, I would say, a must-read for everybody to get deeper insight into what these 10P health or 21st century health can offer. On that, ladies and gentlemen, I hope I have not overused the time. We still have about 8-9 minutes, and I'd be happy to take questions should such questions arise.
All right. Thank you so much, Prof. Georgi, for this such an enlightening presentation, the way you have taken us through the journey of digital health, defining it, especially clarifying our concept, because there are a lot of terms which are being used, e-health, digital health, a lot more internet kind of stuff and applications. And especially the way you have narrated different studies and very useful resources you have shared. Thank you so much. Really appreciate it. I can see that participants, they have started putting up their questions in chat box. So Dr. Chanimi, he has mentioned that, can you explain resource 7 and 8? If you can go back to your slides, and there are two resources, 7 and 8, if you can explain a bit more about them.
Yes, the mobile apps. This is basically an example of Medscape, which is globally one of the top medical education and information resource for medical professionals. As an example, this is just a different. This is just one of the examples of mobile technology and how mobile technology can support on-the-go learning for both medical students, as well as, of course, as an information resource for any health professionals. And number 8 is the interactive digital textbooks that can be basically that with the usage of all the modern technologies. So not just the online resources, but there is a lot of interactive technology that is being provided currently by all major providers of medical textbooks and medical education resources. There's a lot of textbooks that we are ourselves also using in our teaching, and let us say all major publishers such as Elsevier or John Bartlett that we've been using also quite a lot of textbooks by these publishers. They all provide an amazingly useful, very user-friendly, interactive, and great platforms for students that definitely make learning fun and and immersive and much better experience than it used to be.
Great.
There are a few more questions I can see in chat. Thank you very much, first of all, for all these questions. I deeply appreciate your interest. Very insightful, great examples from there. Thank you very much. Do you find students are ahead of faculty in using AI? How can we guide them? This is a fantastic question. Thank you for that question. I can give you a good example. With introduction of, let's say, when the news about ChatGPT broke, and this definitely created I would say, unparalleled revolution, not just in healthcare, not just in elsewhere, but even and also in the education. And you can imagine, and those of you who are in education, of course, who are also teachers, I'm absolutely sure have had the similar experience. We have had a series of faculty meetings, many of them, discussing for hours and hours. How do we adopt and how do we adapt to availability of ChatGPT in our education? For example, what do we do if students use ChatGPT in their assignments, right? And this is one of the key questions that arose in this Gen AI era. And I have to say that it is still not kind of finally resolved. There are many different approaches to that. We have adopted, and my personal approach is, of course, we not only allow students to use ChatGPT in all their assignments, but we encourage them to use generative AI. Of course, one thing that we invite them to do, and we ask them to clearly disclose anything that they use, any usage of Gen AI, but we do teach them even to use excellent prompt engineering techniques in order to obtain the expected results, to obtain great outcomes from generative AI. And this has become, and in my opinion, is absolutely indispensable part and is definitely one of the key learning objectives as of now, ladies and gentlemen. We need to teach also the students to use generative AI, because those who don't use AI in their practice, as one of the eminent influencer in digital health used to say, the AI may not replace medical doctors. Well, this is kind of, I would say, questionable, in my opinion, statement. But even if we consider that AI will never replace human doctors, definitely the doctors who do use AI will certainly replace those who don't use AI. So this is becoming definitely a very important aspect of education, the learning objective. What areas in medical education can AI help? Well, basically almost everything, starting from designing the courses, using GPTs for designing your assignments, and all the way to incorporating LLMs in clinical note-taking, in optimizing the workflows, demonstrating essentially how to optimize workflows. By the way, those of you who are interested in using AI in education, specifically also in medical education, please feel free to connect with me. I would be happy to provide even more insights outside of the framework of this webinar. I'm mindful of the time, of course. We don't have so much time. Unfortunately, understandably, I could talk not for 1 hour or 50 minutes, but for many, many hours or many weeks on all related to this. But I'm once again mindful of time. How is Germany?
Sorry, Prof. I can see there is one hand raised. So, Dr. Chanimi, if you want to
absolutely, let's
unmute and say something.
Question and then
Yeah, thank you very much, sir. It was an excellent presentation. I have only one question. See, we all like this use of AI, but don't you think that gradually use of AI will lose the touch medicine, the feeling of with patient and doctor which we are doing, and the sympathy, empathy, and what ATCOM part we discuss will be lost gradually, because now they are not touching the patient, but only touching the machine. What is your opinion on that?
Very important, obviously, a very important and very controversial area. I would say that, well, empathy, of course, remains, and for the foreseeable future, it will remain kind of within the realm of human interaction, right? Human interaction. However, what is important and what AI is doing, and this is why if we look at one of these texts that I recommended, this Deep Medicine, see the highlight by Dr. Topol, and this is what he is stressing, how artificial intelligence can make healthcare human again. So think about the automation that will essentially allow doctors to free up more time to communicate with the patients, number one. Secondly, a little bit more if we look a little bit more into the future, ladies and gentlemen, let me remind you of one of the recent surveys that find out that patients who communicated with a chatbot actually found out more empathy by the chatbot than by communicating with human doctors. So think about it. The future is going to be dramatically different, dear doctor. I definitely understand your sentiment. We are all very much stressed by unpredictability of the future that is coming up on us absolutely tremendously fast as never before. My recommendation and my advice would be, don't be afraid of it. Embrace it and think bigger, think more about the future. Whenever somebody tells you that AI will never replace human being, just ask them, just answer them. Never say never, because we are unable to even approximately predict what is going to be 20 and 50 years from now. Even in 10, 15 years, let alone what is coming upon us in 30 or 50 years from now. I hope I answered your question.
I do agree absolutely, Prof. Yes, we have to embrace these technologies with open mind and open hearts. And we should free some time for human touch, rather more time for human touch through improving our efficacy. I can see there are a few questions relevant to augmented reality in our chat.
There are a few minutes. This is our end time. Is that okay?
If we can take 5-10 minutes over, that's not a big issue. I shall appreciate your time if you can give us, because there are much relevant questions, if you can address them, which are related with augmented reality. Does augmented reality use real patients? What is its special importance in digital health context?
Okay, augmented reality. Augmented reality has multiple different applications. First of all, we need to remind ourselves, of course, what is augmented reality and how it is different to virtual reality. In augmented reality, the technology essentially provides an additional visual and other forms of information on top of the visualizing of our natural vision, right? Augmented reality technologies are very prominent and can provide a lot of opportunities in areas such as, for example, wound management, right? Now, imagine that there is a health worker, for example, a nurse or a nurse practitioner, a allied professional, who is following the patient post-surgery and is using augmented reality appliance. By the way, an example of augmented reality could be, why not, even the so-called Google Glass that has been adopted also in remote surgery and in surgical training. So it is absolutely possible to record basically what is happening in the wound, to stream it to the remote physician who is seeing it on their screen and guiding the local staff, as well as to provide with some augmentation, with additional visualization, with pictures, with telestration, with demonstrating, with drawing, and so on and so forth. And all of that will be in the view field of the local health worker. So augmented reality is indispensable here. With regard to specifically education, well, of course, the training of healthcare professions, medical training, as we already mentioned, ability to cooperate with a senior colleague per distance. This is already indispensable, but also think augmented reality as in training or the gamification as well, right? In for example, in developing specific skills. So there are multiple applications in training, especially in training skills that require a very significant visual input and output. There can be, tens or dozens of different applications that I could mention. Once again, let us probably go to the next question in order to answer as many of them as we could.
Yeah, there is one question which is again much relevant with virtual reality by Prashant, that what justifies the adoption of expensive tech like virtual reality in medical education in first place? It undermines the importance of human interaction and tactile sensations, and also puts settings with limited resources big great disadvantage.
Very good question. Very good question. Very important discussion also. Let me answer this the following way. What, at first instance, what do you think costs you more? Using, let's say, the latest generation iPhone or any other smartphone in order to communicate, or having, let's say, a paper notebook and a pen. Now, the easy and the first instance, first kind of approach answer to this question would be, of course, a smartphone that you spend, let's say, $1,000 to buy might cost you more. It's a costly technology. However, when you look into how much gain in efficiency you can have with using this costly technology, with freeing your time, freeing resources, and in the long run, you come to understand that it is essentially much cheaper to spend those thousands of euros or dollars to buy the expensive technology in order to gain a lot in efficiency, freeing of resources, and eventually even overcome. It has been actually demonstrated. All of that has been demonstrated by research, ladies and gentlemen. Remember, I told you that digital technology, even though it requires initial investment, but it has been demonstrated that full implementation, effective, efficient, judicious implementation of digital technology should actually provide cost reduction and should provide saving. And this is exactly same is applicable also to usage of extended reality, including in medical education.
Do agree. Yes, wonderful. So far, we have taken up all questions. My only question is that you have provided a couple of barcode and courses. Are they all free, or we have to pay for that?
Which QR, which resources you of course.
Like these links, if we want to do some digital health course on Harvard University or California.
No,
Yeah.
this is not about the courses. This is just examples of case
All right.
studies to exemplify. There are courses that are free, of course. There are some courses that have to be paid for. I am obviously I could not include all the the list of all possible offers, educational offers in digital health ourselves. We provide also, excuse me, quite a lot of learning and quite a lot of training in digital health. I would say that it's probably would be easier to just connect with me, asynchronously after this webinar, and I would be happy I would try my best at least to provide as much advice to as many people as is possible.
Sure.
There are probably a couple of other questions that we have so far missed.
Last one, just comment came. Who said thanks, and a call he has mentioned that for the case developing nations, issues of AI is still untouched. What we are focusing first is digitalization care health system. Here, I wanted to ask a question for complicated issues like surgeries that make people worry of success rate and emergency cases. How can the AI help to reduce anxiety to the family of patients?
This is one of the specific applications of essentially of generative AI, which is also currently being used, has already pioneered, has already been applied. For example, these generative AI or large language models can easily be applied and adjusted to provide patient and family information, right? And in that regard, also freeing time for health workers to focus on other activities. Basically, the AI and especially generative AI, bottom line here is that whatever can be done, whatever can be automated or can be generated with the use of AI is perfectly fine because, again, keeping in mind the burnout, the tremendous stress for health workers, following all these, especially following all the novel modalities, all the novel techniques. Whenever we are able to save even a few minutes times by health workers on some tasks that can be automated with the use of AI, and in this case, for example, communication with patient family, communication with the patient, or presenting information to the patient in a more easily understandable way. And once again, think about a possibility to do it using extended reality, by the way, and metaverse, not only LLMs. So again, multiple wonderful possible applications. A request to share recording and share details. My details are actually, we have here again QR code, the easiest way to connect with me, just through LinkedIn. So all details are there. And the recording, of course, as Dr. Iqbal,
we will share
it with anyone. Many thanks for amazing discussion. Thank you very much. Machine more is very sad at the same time. Yes, machine is more human than a real human being. May happen. It may happen. Yes, unfortunately, because keep in mind that not all humans always. This is a very interesting, also an amusing discussion. We are currently expecting sort of, right, and criticizing AI and other automation technologies for not being always 100% accurate. I think we have even a comment here regarding hallucinations. Sure thing. We know about inaccuracies. We know about hallucinations. Black box data processing system. Of course, we understand all that. Now, here is the kind of a question for you to sort of to reflect on. Why do we expect AI systems to be always 100% accurate if we know that humans are prone to making mistakes? And don't we agree that AI, even at the current stage, is much more accurate and much less likely to commit mistakes than humans? And I can refer here to the famous paper that essentially launched kind of, or provided the major impetus for digitalizing health information systems in the US. It is a landmark paper that was published by the US National Academy of Medicine, back then Institute of Medicine, that was titled "To Err is Human," and that for the first time demonstrated that human-related, avoidable human medical errors may result in a minimum of 100,000 preventable deaths only in the United States alone every year, ladies and gentlemen. Think about that. However, we do not expect humans to always be 100% accurate, right? But we expect machines to always be 100% accurate. Of course, some inaccuracies may be there, and this is one of my major concerns. How do we improve this technology in order to make it more and more and more accurate? But once again, we all understand, and I think it is indisputable, that there is no human being capable of processing as much information as computers can process with similar or close to machine efficiency and with close to machine accuracy.
Yeah, wonderful. So I think this discussion is never ending, and it is such an enlightening discussion that we want to continue. But looking at time, I think we need to stop here. And thank you so much for this wonderful session, Prof. Georgi. And I hope that in future we will invite you again, especially when you say metaverse. It is really tantalizing for us. And hopefully we will arrange some other session at SSME forum again as well. And thank you so much to all participants for joining us today. And definitely recording of this session will be shared with all of you who joined us today and registered as well. So have a wonderful rest of the day. And thank you so much, Prof, once again for your time and efforts.
Thank you very much.
Bye-bye. Have a great day. Bye-bye.